This is Dr. Deuk at Deuk Spine Institute. I'm here with one of my patients who underwent the Deuk laser disc repair at L5-S1 on the right side about 3 months ago. And we don't get a lot of 3-month follow-up because our patients are doing fantastic and they usually don't want to come back after the first week. But this gentleman here is here. He's a longtime patient of mine. And why did you end up having the Deuk laser disc repair for herniated disc at L5-S1?
Well, the pain in my back was from a pinch nerve. It looked like in a bulging disc, and the easiest way to have it repaired obviously was laser surgery, and the least intrusive. And it really didn't put me down for a long time. Very quick recovery, and it really worked well for me in probably about a week. I mean, I had a few tingles as it was healing, and then after about a week, 10 days, it was just like nothing had ever happened. It was just like I was normal again.
Great.
And I got my mobility back. I was able to bend over, pick up things. I'm able to move and to walk and jog some now, you know, without pain. It's fantastic.
Now, would you say the effects have lasted for 3 months? I mean, we're 3 months after surgery. Is it still working for you?
Absolutely.
Perfect. Yeah.
Yeah. I think it's a it's a permanent fix, and it's something that. When I had the choice of possibly injections or the surgery is certainly a lot more of a permanent fix than just, a shot that will keep you going for a while.
So I've been doing the Deuk laser disc repair now for about 14 years, and we look back at our patients that had it done many years ago, and we studied their outcomes. If they've had 5 years of follow-up or more, their average for that group was 6 years of follow-up, and they had 95% relief of their back pain on average and 95% relief of the leg pain on average, or leg symptoms. So this surgery, the Deuk laser disc repair, has a long-term benefit. Now you've had other surgery on your back, like a fusion, right?
Yeah, we had the fusion for the L3, 4, and 5, which was due to previous injuries and just a robust life, and it did great, and also didn't have any problem with it. It relieved all the pains that I was having. It relieved all.
Who did that fusion?
You did, and that was 2 years ago, and that's worked out beautiful. So I'm making progress, and I think it's just now get this right hip fixed and I'll be good to go.
So fusion 2 years ago, laser surgery because you had another herniation below the fusion.
Mm-hmm.
Comparing the two surgeries, which would you say is better?
I think they were both effective. They both worked. I think obviously the L3, 4, 5 was a much more major problem and took more of a major undertaking to fix.
Longer recovery from your standpoint.
Longer recovery and everything, but it was a much more acute problem than the laser surgery. The laser surgery was more directed toward one particular spot, and it was very simple and it was very quick to recover from. The fusion took a little longer to recover from, but it also was quite effective.
Yes.
And and I haven't had any after effects or any negative problems with it at all since then.
And that's what I tell everybody, is that if you have a spinal fusion done by Deuk Spine Institute, there's a technique that we use that is able to eliminate the back pain and the leg symptoms, 95% each. It's the same results as the Deuk laser disc repair, 95% elimination of back and leg symptoms. The difference is with a fusion you're having a big open surgery and it's a much longer recovery, more painful recovery.
Right.
Wouldn't you say?
Yeah, it took a lot more effort.
Yeah, so you actually have a very special patient here with an experience that's very unique in that I did his decompression, realignment, and instrumented fusion at L3-445 2 years ago. So he went through that surgery and that recovery, He developed adjacent segment disease with a herniation at L5-S1 with right leg symptoms, and he just had the laser surgery 3 months ago, and he's doing fantastic. And the summary is they both work, whether you have the Deuk spinal fusion or you have the Deuk laser disc repair, but the recovery is much faster with the laser surgery and less painful and less risk. So anything you want to say to the rest of the world at all?
Yeah, if you have a problem, this is the man to see.
Thank you very much. Appreciate it. All right, stay safe.
Okay.
Good luck with that hip surgery.
All right, thanks, and let me know what Dr. Sands